We do have a couple of questions, one from Katie, and I'd said that once Anne had finished her presentation, we would come back to. I think there might be something with our teams today. Certainly mine is a bit slow, so apologies. They may have come in after and the refresh has picked up. So Susan's going to come back on, and she's got if we can pick up Katie's question, Susan, and we've got one from Paul Smith as well. So I'll hand back to Susan on this. Thank you.
Okay. Thank you for bearing with me during our technical difficulties. And just be reassured as well that the presentation that will be on our website looks a bit different from what you actually saw. So we've got two questions here. One is it a mental health setting or any ward that somebody can be detained? So the intention was that it was a mental health setting, but each individual circumstances do have to be taken into account. And if somebody's life is at stake, then common law should be used, and the nurse should be able to keep the person on the ward should it be required. But again, it is about getting that review as soon as is possible. So the other question is, do hospital grounds count as being hospital? So yes, is the straight answer. So it's within the hospital grounds. So if somebody manages to leave the ward, you are still able to prevent them from leaving the hospital grounds. So those were the two main questions. So hopefully they're answered. But if there's any other as we're going on, please don't hesitate to ask. So I'll now pass back to Claire. Thank you.
Thank you. I'm not seeing any other questions in the chat, and I've refreshed it. So I am.
I think it's really interesting what Susan was saying, because we've had a couple of recent scenarios where staff have asked, they're in a community mental health setting, and whether or not that this part of the legislation could be used. And actually what we've always said in our guidance, isn't it, that it is that bit of assessing necessity at that point, and actually thinking about using common law or whether or not there's a doctor available. But I think there's always something about risk, isn't there? And that's the bit that always will come back. Is this individual at risk of leaving this environment at this time, and what can I do in terms of safeguarding to ensure that that individual or anyone else is going to be placed at risk? But I think we do get a little bit caught up in, what can I do, what can I not do? But ultimately it always comes back to risk and safeguarding, and ensuring that you're having that conversation with key people as well, that it's not a unilateral decision.
Good point, Anne, is when the Act was written, the variations in community hospitals, the development of liaison psychiatry, A&E services. So there may be other situations, and I think what Susan picked up in the presentation, if you are an individual in that prescribed class, and you at that point, as Anne's picking up in terms of the risk, and what you're seeing, if you're not an individual that prescribed class, then the common duty is available. But for those of us that are RMNs or are NLDs, then that opportunity, this hospital thing that was set up in the 2003 Act, can still cover it from an A&E perspective or a community hospital, as long as you consider that there are risks and that individual will not, the assessment needs to be undertaken, and a medical assessment at that. So yes, it's the Act was written, it's 20 odd years now since it's gone, and things have changed markedly. So it's where when a call to the Commission, as Anne said, is probably a useful adjunct to being able to know exactly that you're doing it in the right way. I'm not seeing anything else. Maybe my colleagues are saying, can we just check? There's nothing else in the chat at this point. Fantastic. Okay, we will give you back the remaining time of what you have and just say thank you very much. We're very happy to send out a CPD of the event that you've joined us for this afternoon. And as Anne's already said, please get in touch with us. We always enjoy. There's generally one of the nurses on the advice line most days of the week, so you'll be able to have a blether with us. And also, if you know that we're coming out to do a visit, always happy to have a conversation with nurses, student nurses, and any other members of the team. So all it leaves for me to say is to thank Anne, to thank Susan, and to thank you for joining us this afternoon, and to say farewell. Thank you.